Yeah, welcome once again to my YouTube channel. Yeah, thanks for subscribing. All those who have finished to subscribe, thank you very much. Those ones who have not subscribed yet, make sure you subscribe. Yeah, today we are going to look at what we call hyperhidrosis or excessive sweating. Excessive sweating is a disease. Some of you have not considering it to be a disease, but to others who it had made some discomforts and other effects, it's really a disease and an embarrassing disease and a very big discomfort. We have two types. One is what we call axillary hyperhidrosis. Then the second one is what we call palmoplantar hyperhidrosis. With axillary is under our armpits. When you are over sweating under the armpits, then what we call the palmoplantar under your palms and the feet. What causes it? We have certain foods and odors we use, like perfumes, which can stimulate our sweaty glands to produce more and more and more of this sweat, and also to stimulate the nerves which command the sweaty glands to produce more sweat. Such foods include excess take of citric acid containing foods. We have caffeine. We have what we call chocolates. They can lead to this effect. Other effects, they can be injury to the spinal cord. It can be an anxiousness. When you are anxious about something or anything and you oversweat. So other issues, we have menopause in females. When you are attending to menopause, you can get this kind of disease and excessive heat in the body. So treatment, how do we treat it? We have both medical treatment and procedures. Medical treatment, we can take oral anticholinergics. They can suppress the effect of the sweaty glands, of overproduction of the sweat. We have what we call the antiaspirants. This one will also seal the sweaty glands so that you don't produce more sweat. These ones contain, you can use Drysol, you can use Xelac. It can work very well. Your clinician can as well prescribe for you a beta blocker, which will help to suppress the effect of these glands. And at the end of it all, you will be relieved from this burden of having this what we call excessive sweating. What are the procedures that we can do, provided the medicine has failed? The procedures. We are going to look at the procedures that we can. So, after using the medicines or the medication we have seen, the aluminium-based perspirants, the anticholinergics, and the beta blockers. In case of anxiety, your physician can as well prescribe antidepressants such as they bring you down, they calm you down so that these glands are not overstimulated. So once the medication fails, we go to the second resort. Those are procedures. One of the procedures is what we call ionophorosis. This one, you get the part which has glands that are hyperstimulated. We put it in water, then we get a suitable device, a special device, which passes a low electrical current in that water. This electrical current is going to go and suppress these sweaty glands so that you don't get out of sweat. Second one is what we call botulinum toxin injection. We inject botulinum toxin into your body. What does it do? It is a presynaptic blocker. So it blocks the neurons that are going to send impulses for the overstimulation of your glands. Another one is what we call microwave, using a machine which sends what we call thermal energy, targeting the glands that are overstimulated, so that will kill them and suppress them, so you don't get what we call hyperhidrosis. Thirdly, we can use what we call laser. We get a laser beam and we target those hyperstimulated glands. so that they don't overstimulate, they don't overproduce the sweat. After all those have failed, we have done ionotophoresis, we have done microwave, we have done botulinum injection, we have done laser beam, and they have failed. We do what we call a sympathectomy. What does it mean? We remove those glands surgically. We cut the part which has glands that are hyper-stimulated. We remove the glands directly. So we cut out the glands such that you are relieved from this problem of having what we call hyperhidrosis.